Hi, Mike Gibson, Raj Makkar coming to you live from ACC 2023, and we're talking about the safety and efficacy of transcatheter edge-to-edge mitral repair. Talk to us a little bit about where we're at.
Hi, Mike. What we did in this analysis was we analyzed patients from the STS ACC TVT registry. There were about 19,000 patients in this registry who underwent the TEER procedure, edge-to-edge repair procedure for degenerative mitral regurgitation of at least moderate to severe or severe, mitral regurgitation. And what we found was that, number one, the patients that were enrolled in this registry were of advanced age and had substantial comorbidities. The median age was 82, the median STS score was 4.6, 20% of them were diabetics, 45% of them had coronary artery disease, so lots of comorbidities.
Yes.
The second thing that we found was that the MR success, which is what we defined as reduction in mitral regurgitation to moderate or less without developing severe mitral stenosis, was achieved in 89% of the patients.
That's amazing.
All right, so I think this is, all comer patients. The number three thing that we found was that patients who had a successful procedure, defined as MR success, at 30 days, those patients had much better clinical outcomes when they were followed up to 1 year. So the death rates were half in patients who had successful reduction in MR to moderate or less compared to patients who actually did not. Similarly, heart failure rehospitalizations were cut in half. Mitral reintervention rates were cut in 1/5.
Wow.
So there was a real impact of what was observed on echo in terms of reducing MR, in terms of making an impact on clinical outcomes at follow-up. We also looked at not just residual mitral regurgitation of moderate or less, but then we further broke it down and did the analysis to see if reducing it to mild mitral regurgitation made a difference. And indeed, actually it did. So the hazard ratios between moderate and mild were actually 0.75 approximately, adjusted hazard ratios. So suggesting that whenever possible, you do have to try and bring the mitral regurgitation down to mild. We also looked at the impact of gradients. More than 10 was defined as failure or failed procedure, but less than 10 was divided as, up to 5 and more than 5, but less than 10. And there too, gradients made an impact. For a given degree of mitral regurgitation, lower gradients were better than higher gradients in terms of clinical outcomes.
And all this is some early generation devices, further improvements to come. So I think we can see hopefully some even better results in the future.
Yes, we did observe an improvement in the time period.
Right.
The success rate was 80.5 in 2014, and it has come up to 92.2.
Yeah.
And of course, the improvements continue to occur as we move forward.
Great. Raj, thanks for joining us. Thanks to all of you for joining us here live from ACC 2023.